एक बोतल करे खाते कदे वेट करी ले हेलो
Welcome all to World Blood Donation Day, Blood Donors Day, a awareness program. On this occasion, we honor our prestigious lifesavers who donate blood for the cause of life saving. Welcome all participants, all faculty members. Welcome Dr. Sandeep, Dr. Swati Chauhan. With their sessions, we will be able to get what is exactly a blood blood donor donation promotion activity is, and Dr. Sandeep will tell us about the blood transmitted transfusion screening and transfusion reactions. So, first of all, we are honoring our blood donors who belong to Apex family. So, we have prepared a short video with their certificates, which we are providing to them. All participants are requested to mute your audios. It is on because it is on the same one. Now, I welcome Dr. Swati Chauhan to present her session, which is based on blood donation promotions. Welcome, Dr. Swati.
So, the theme for 2020 Blood Donors Day is Save Blood Saves Lives. And the slogan is Give blood and make the world a healthier place. One blood donation can save up to 3 lives.
As with the help of component
With the help
preparation,
of component preparation, we can prepare the red cells, platelets, fresh frozen plasma. So, 3 lives can be saved with the help of one blood donation. Blood cannot be manufactured, it only comes from the voluntary donors. Blood donation not only saves lives but also helps people live and have a productive life. So, in the Apex Super Speciality Hospital, the Blood Donor Day was first celebrated in 2004, and we are celebrating the 17th anniversary of the World Blood Donor Day today. It is celebrated across the world to raise the awareness of the need for safe blood and blood products and to thank the blood donors for their voluntary life saving gifts of blood. So, what is actually the safe blood transfusion? Safe blood is the right blood given to the right patient at the right time. So, what is the right blood? Right blood is to be compatible with the patient, then it should be free from all the transfusion transmitted microorganisms. It should be given to the right patient. Right patient means positive patient confirmation. It should be confirmed that the particular blood is compatible and has to be given to a particular patient. So the documentation and communication should be proper. And what is the meaning of right time? As the blood leaves the controlled temperature setting of the blood bank, it should be transfused to the right patient in the designated time. Talking about the types of donors, we have 3 types of donors: the replacement donors, voluntary donors, and professional paid donors. About professional paid donors, uh, it has been banned in India since January 1988. So it is no longer encouraged or allowed. The other two kinds of donors are replacement donors and voluntary donors. The replacement donors can give blood to replace the blood used by a patient, particularly done by the relatives and friends of the patient. But the voluntary donors give blood willingly without being asked, without compulsion or any promise of remuneration. So, in Blood Donor Day, on this day, we are actually encouraging the voluntary blood donation. Talking about some data of past 2 years, in India, as per the data of 2018, 30.4 million units of blood was required. However, 11.5 million units of blood was donated. And about last year, 2019, India faced shortage of 1.95 million units of blood. That means we need more voluntary blood donation in order to fulfill the requirements. Where do we need the blood? Indications of blood transfusion. So, as I was talking about the components of blood, we have whole blood, then the components are red cell, platelet, and fresh frozen plasma. The whole blood can be transfused in acute blood loss and exchange transfusion in neonates. The indications of packed red cell are hemoglobinopathies like thalassemia, sickle cell anemias, severe anemia with congestive cardiac failure in elderly, acute blood loss, and cancer patients. Fresh frozen plasma, it is given to multiple coagulation factor deficiencies caused due to liver diseases, warfarin overdose, disseminated intravascular coagulation, inherited deficiencies of coagulation factors, and TTP. Platelet concentrate is given to the patients with bleeding due to thrombocytopenia, like patients of dengue, malaria, and patients with the platelet function defects. 1 pint of the blood can save up to 3 lives that we have already talked about. Now, what is actually 1 pint? 1 pint is 473 ml of blood. 1 unit of whole blood consists of 350 or 450 ml of the blood, depending upon the blood bag used. Adults have around 10 pints of blood in their body. That is nearly 5 liters of blood. And 1 pint is given during a donation. So basically, 7% of your body's weight is donated. Facts about blood and its components. The human blood consists of 55% of the plasma, 45% red blood cells, and rest are the white cells and platelets. Blood groups in India, the most common blood group is O blood, comprising 37%, and the least prevalent is the AB blood group, which is 7%. 94.6% of the donor population is Rh positive, and the rest are Rh negative. Rh positive donors are encouraged to donate, and here this is encouraged to register as voluntary donors and provide their phone numbers. As Rh negative blood groups are rare, and in cases of need, they can come and do the blood donation. Type O negative blood red cells can be transfused in patients of all blood types. It is always in great demand and in short supply. Type AB positive plasma can be transfused to patients of all other blood types, as it doesn't contain any antibodies in it. Newborns requiring exchange transfusion are O negative red blood cells in AB positive plasma. Facts about the blood donation process. It is a safe process. A sterile needle is used only once for each donor is then discarded. It is a simple 4-step process which includes registration, medical history and mini physical examination, blood donation, and refreshments. The actual blood donation typically takes less than 10 minutes. The entire process from the time you are in the blood bank to the time you leave can take about an hour. A healthy male can donate red cells every 3 months. A healthy female can donate red cells every 4 months. A healthy donor may donate platelets at a gap of 2 weeks, but a maximum of 24 times a year. All donated blood is tested for HIV, hepatitis B, C, syphilis, and other infectious diseases before it can be transfused to the patient. This picture shows the sequence of events carried on during the blood transfusion. Uh, it includes the hemoglobin estimation, part preparation, collection of the blood, then preparation of the bags, proper labeling, sealing of the bags, and storage. Benefits of donating blood: burns calories. Unit of the blood, donating 1 unit of the blood can burn 500 calories in the donor's body. So, unabsorbed excess iron in the body is deposited in the liver, pancreas, heart, and can cause hemochromatosis and other associated conditions. So, the regular blood donation helps in maintaining the iron levels in the body and hence protects and prevents the risks of cancers, cardiovascular diseases, heart attacks, and other diseases. So, what are the benefits of donating blood? It brings joy, saves lives. There is a free health screening and mini checkup, as the hemoglobin, pressure, pulse, everything is checked. The HIV, hepatitis C, malaria list screening, so that is also helpful. It enhances the production of new blood cells. Starts within 48 hours of blood donation, and it can help the body to work more efficiently. So, I'm ending my session with the fact that if someone begins donating blood at the age of 18 and donated every 3 months until the age of 60 is reached, he or she would actually be given 500. Thank you.
Thank you, ma'am. I request Dr. Sandeep to present his session on blood transfusion screening and donations. Please welcome Dr. Sandeep Notia.
Institute of Science. Something about it? Participants देखेगा. Monday, yeah, on one last.
Good afternoon. I'm Dr. Sandeep. I'm going to, and in fact, हाँ सब लोग म्यूट कर लें, अपना अपना ऑडियो म्यूट कर लें। अभी जो आप लोगों को टॉपिक बताने जा रहे हैं दैट इज इन्फेक्शन प्रिवेंशन एंड ट्रांसफ्यूजन।
पैसा निकालना जनरल पब्लिक भी तो जाती थी वहाँ
रिएक्शन
तो
एंड यूजर्स अपना अपना ऑडियो म्यूट कर लें। हेलो This talk is focused on our end users, clinicians, duty doctors, and nursing staff who are directly involved in patient care and providing blood transfusion to the patient. Objective of this talk objective of this early action of common effect reactions from and manage the common transfusion reaction. That transfusion is the transfer of blood or blood disturbance for blood transfusion is transfer of blood components from vein of one person into the bloodstream of another person. Blood transfusion short, it is a life-saving menu with a life-threatening potential. Purpose of blood transfusion. Purpose of blood transfusion. We transfuse blood to restore the blood by replacing red blood cells, to maintain platelet count and avoid bleeding, to replace coagulation factors. Transfusion reaction is unfavorable transfusion related event that occur in a patient during or after transfusion of unfavorable during or after transfusion of blood
पैसा देना पड़ता है
the group of किसी और का ऑडियो सुनाई दे रहा है group of serious hazards of transfusion. Some facts about the transfusion reaction. Incidence is 3% of total transfusion. Age, children are at higher risk of developing transfusion-related HIV. Sex, non-hemolytic failure and extracellular hemolysis are more common in females. Blood transfusion reaction. This is the 5 diseases which are common and or in blood bank. Hepatitis B 1.4 to 1.6%, hepatitis 0.4 to 0.5%, HIV 0.4%, syphilis 0.22%. In blood bank, transfusion transmitted infections are detected by 4 methods. First is rapid card. Second, ELISA use generation and validation ELISA. CLIA, chemiluminescence immunoassay. Currently, we are using chemoassay. Best is nucleic acid testing. CLIA has a better sensitivity and specificity. Advantage of CLIA over ELISA. For CLIA is fully automated. Random sampling can be done. Increased sensitivity and specificity. Less people is required. Rapid tag. Less manual handling. Less chances of window period during the development of new infection patient in a previously non-infected person, which in this period person may be very infectious, but detectable level of antibody is not yet appeared. Window period is between infection to lab detection. Window period of HIV, window period depends on method of testing we use. Window period for HIV is third generation ELISA or CLI for 2 to 3 weeks. Net testing, it is 1 to 2 weeks. Window period of hepatitis B by ELISA is 60 to 90 days and by net it is 15 to 35 days. Window period of hepatitis C by ELISA is 6 to 9 weeks and by net it is 10 days. To minimize risk of transfusion transmitted infections, first step is detailed and careful donor screening. Detailed and careful donor screening is vital and has then proper TKI testing. Testing for hepatitis B, hepatitis C, HIV, syphilis, and malaria. Blood transfusion reactions classification. We can classify blood transfusion reaction into two types: acute or immediate reaction and reaction. Symptoms appear for maximum up to 24 hours. Delayed reaction occurs after more than 24 hours and may take up to months. Now coming to clinical presentation. We have hemolytic reactions present with fever, chills, rigor, chest pain, hypotension, nausea, dyspnea, tachycardia, anxiety, bleeding, DIC, back pain, polyuria, pain at infusion site, hemoglobinuria, and shock. Cause of immediate intravascular hemolysis is ABO incompatibility, and delayed extravascular hemolysis is not related to ABO compatibility. Next is febrile. Febrile reactions present with increase of temperature more than 1 day without other explanation. Chills, rigor, headache, nausea, and vomiting. Cause of febrile reaction is leukoagglutinins, platelet antibodies, pyrogens, bacterial contamination, and cytokines. Allergic reactions, sign and symptoms are local erythema, rashes, and itching. It is due to allergy to soluble products of donor plasma. Sign and symptoms of anaphylactic reaction are coughing, bronchospasm, abdominal cramps, vomiting, shock, and loss of consciousness. Cause of this anaphylactic reaction is anti-IgA antibody in IgA deficient patients. Circulatory overload. Transfusion associated associated circulatory overload is termed as TACO. Sign and symptoms are coughing, cyanosis, dyspnea, heaviness of chest, and headache. Causes hypervolemia. It is due to volume overload or high transfusion. And non-cardiogenic pulmonary edema is transfusion-related acute lung injury. Only we can see is pulmonary edema. Causes glucoagglutinates due to reaction glucoagglutinates W. To differentiate between trolley, we observe following findings. BP is normal or high in transfusion associated circulatory overload, and in trolley it is either low or normal. Body temperature is normal or elevated in trolley, which is normal in TACO. Chest X-ray is normal in trolley, and vascular congestion is in TACO. Pleural effusion is common. BNP is high in TACO and low or normal in trolley. Then we categorize transfusion reaction into mild, moderate, and severe. Mild transfusion reactions signs are localized cutaneous reactions, urticaria, rashes. Symptom is pruritus. It is due to mild hypersensitivity and can be managed easily. Moderate reaction signs are flushing, urticaria, pruritus, fever, restlessness, tachycardia. Symptoms are pruritus, anxiety, palpitation, mild dyspnea, and headache. Are moderate hypersensitivity, peptide non-hemolytic transfusion, antibodies to WBCs, antibodies to some proteins, and pyrogens. Severe reaction are characterized by hypotension more than 20% of systolic and tachycardia more than 20%. Rigor, fever, restlessness, hemoglobinuria, and DIC are other signs. Symptoms are anxiety, chest pain, pain at infusion site, respiratory distress, flank pain, dyspnea, and headache. Possible causes of severe reaction are acute intravascular hemolysis, bacterial contamination and septic shock, fluid overload, anaphylaxis, and trolley. Doing transfusion of blood component, we must document temperature, pulse, blood pressure, respiratory rate. We must note at least 7 to 8 times. Baseline we note at start of transfusion. Then to rule out acute reaction, we should note at 15 minutes, and then after every 1 hour till the end of transfusion, and after 4 hours of transfusion completion. In addition to vitals, which we note 7 or 8 times, general condition of patient, fluid balance, oral IV intake, and urine output, time of start and completion of the transfusion, volume and type of blood component, donation number, and any adverse reaction if happen. Then management. Immediate management done by nursing staff. He or she should stop the transfusion immediately and notify the doctor on duty. Keep the IV line open and flush with normal saline. Report the suspected reaction to blood. Inspect the bag manually for any reaction in hemolysis and recheck the findings on blood bag and patient for any clerical error, blood bag number, group, cross match level, and name and ID of patient. After that, collect the patient's EDTA, plain and urine sample and send to blood bank. Management to be done by medical officer. First of all, medical officer has to characterize the reaction in mild, moderate, and severe. If there is mild reaction, itching, then he should slow the administer antihistamine. Patient usually improves, but if no clinical improvement up to 10, consider it as category 2. Category 2 is moderate reaction. In this, stop the transfusion, replace the infusion set. Sometimes the reaction is due to infusion set and things correct after replacing the infusion set. Then open it with normal saline. Send blood bag with infusion set and patient's sample from opposite ends. जिस आर्म में ट्रांसफ्यूजन हो रहा है उसके अपोजिट हैंड से सैंपल लेना चाहिए. एडमिनिस्टर एंटीहिस्टामिनिक आईएम. एंटीपायरेटिक्स देने हैं but avoid aspirin. IV corticosteroids and bronchodilator should be given if anaphylactic reaction is there. Collect 24 hours urine. If clinical improvement is seen, restart the transfusion with a new unit. If no improvement is observed within 15 minutes, consider it as category 3. Category 3 are severe reaction. In this, initial process is same. Stop the transfusion, replace the infusion set, keep IV line open with normal saline. In addition, maintain airway by high flow oxygen mask, maintain breathing and circulation. If patient is hypotensive, then elevate the foot. Give diuretics to increase renal perfusion. Send the perfusion set and pulse from opposite hand. Management by medical officer continues. After administering antihistaminic, assess the bleeding site, bleeding from the puncture sites. If bacterial infection is suspected, then start broad spectrum antibiotics. If hypocalcemia is there, then give calcium gluconate, endotracheal intubation if required. Place a Foley's catheter so that post-transfusion urine output can be measured. Try to maintain the urine output 30 to 100 ml per hour. Laboratory investigations are done by blood bank. ABO and RH grouping from both bag and pilot tube box. On both pre and post-transfusion sample, ABO RH grouping, direct antiglobulin test, Coombs test, then antibody screening, repeat Coombs cross match, assess for serum bilirubin, platelet count, PP and FPGT, and try to have an ECG showing prolonged QT massive transfusion. Categories and proportion of these errors and found aims. The sampling error was found because it was requesting errors. Lab in blood bank, laboratory sample handling and testing errors 9%. Laboratory component selection and handling and storage issues 11%. Component collection, transportation, handling and administration error involved 11%. Thank you.
Thanks, sir. Thanks for your valuable contribution to this blood donation awareness program. I thank all the participants, all directors, and especially our chairman, sir, Dr. S.K. Singh, who motivated us for this campaign. And for this World Blood Donors Day, we are marking the entire month with the blood donation camp, which is starting at 10 a.m. in the morning till 4 o'clock. So I I thankful to all the participants and our consultants, Dr. Sandeep Nautiyal and Dr. Sati Chauhan for their presentations. Thanks.